Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. As part of this briefing, we'll have an opportunity for live Q&A with our experts, and we'll be offering these 30-minute briefings regularly on Fridays at 12 p.m. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time today, so please submit your questions in the box at the bottom of your screen. Before I turn to our experts, I want to remind you that the Coronavirus Resource Center recently launched a newsletter called The Week in COVID-19. This is a wonderful way to get the latest analysis from our experts on topics ranging from vaccines to variants to masking to other vital COVID-19 trends. You're going to see a banner throughout this briefing on your screen that you can click, and that will take you to the sign up for the newsletter. Today, I am joined by two guests. First, Dr. Brian Garibaldi, who's the director of the Johns Hopkins Biocontainment Unit and an associate professor at the Johns Hopkins School of Medicine. Brian is going to give us an update about the treatment of COVID-19 patients and thoughts about moving forward in this pandemic. Second, Dr. Bill Moss is executive director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health. Bill will give an update about COVID-19 vaccines. I'm now going to turn to each of our speakers for a brief overview. Brian, first to you. In the US, we continue to hear optimism due to sustained declines in daily new cases. CDC has now issued new masking guidance. People are making plans to see family and friends, and a lot of people think that summer 2021 will help them to compensate for the pandemic summer of 2020. So as a clinician, what do you think about this mindset, especially given the global situation?
Well, I think we need to recognize that things are getting better in the United States, and a lot of that has to do with the way the vaccine is being successfully rolled out. So I think we do need to recognize that things are getting better. We're seeing new guidance from the CDC about what vaccinated people are able to do, and we are seeing a decline in cases as well as hospitalizations as well as deaths. We're below 40,000 cases a day in the U.S. for the first time in a while consistently. We're seeing less than 1,000 deaths per day, and that continues to go down. But I do think we need to remember that there's still a large percentage of the population that's not vaccinated. And as long as we continue to have these pockets of people who are not getting vaccinated for any number of reasons, we're going to see cases coming into the hospital. So I think as a frontline provider and someone who works in healthcare, I'm excited to be able to do more with my family. My kids actually just got vaccinated last night, which is wonderful. But I think we all recognize that COVID is going to be here for a while, and we're going to have to continue to take care of patients who unfortunately are still going to become ill. I do think we also need to be mindful that this pandemic is not over until it's over across the world. What we're seeing, particularly in countries like India and Brazil, in terms of widespread transmission, number of cases, number of unfortunate deaths, and the way that the healthcare system is being overrun in some of these countries, I think it's an important reminder that this is a global response, and I think we need to continue to engage and expand our engagement in terms of what we can do from the U.S. side to help support vaccination campaigns and help support the care of folks who are not able to get vaccinated yet and are clearly shouldering a large burden of COVID-19 in other parts of the world. I know Bill's going to talk about the vaccines for 12 to 15-year-olds. I think that's a really exciting opportunity for folks who do have younger kids who fall into that category to think about how they can get their children vaccinated and potentially begin to think about how that impacts family activities and what you're able to do with loved ones. And I do have, I haven't had yet a chance to really process the new mask guidelines that came out about vaccinated people. I know Bill's going to talk about this, but I think we have to remember that vaccines are incredibly effective, but wearing a mask at this point is also a personal choice about your own situation and about your own tolerance for risk, because there are situations in which it would still be appropriate for even a vaccinated person to think about wearing a mask. So I think we need time to think about how we want to apply these to our own lives, and also begin to think about how these are going to be applied to social situations like businesses, restaurants, schools, universities and the like. So I think we have a lot to process now as we're getting more data about the effectiveness of vaccines and what to do with social distancing and masking. But I think it's exciting that we're even able to have these discussions right now. We would not have been in a position to have these discussions even weeks ago when we had much higher levels of community transmission. But we still have to be mindful. There's still a lot of transmission out there, and there are a lot of people. We need to figure out how to encourage people to get vaccinated, because that's really the only way out of this in the US, but also for the world.
Thanks, Brian. You told me that once your children were eligible, they would be first in line for the vaccine. And I see that you are a person of your word on that one.
Absolutely.
Before I turn to Bill, a few reminders for our audience today. First is, as you listen to our experts, if you think of questions, please do submit them. I'm keeping an eye as they come in. And second, you'll see the banner on your screen to sign up for our newsletter, The Week in COVID-19. It's a wonderful way every Monday to get the latest insights from our experts. And now I'm going to turn to Bill. So gosh, Bill, there's been a whole lot of activity this week in the US and around the world in terms of vaccines. But I wanted to start by asking for your take on the big news this week from FDA and CDC in terms of vaccination for 12 to 15-year-olds. Many parents, like Brian, are excited to have this opportunity finally to have their children vaccinated. Others feel some reluctance. So to start, what's your take on COVID vaccines for this age group?
Yes, thank you, Lainie. And it certainly was a big week with the approval or the authorization for the Pfizer messenger RNA vaccine for children 12 to 15 years of age, as well as the new CDC guidelines on releasing the vaccine mandate on fully vaccinated individuals. So I think both of these are really reasons to celebrate and be optimistic. They certainly come with their challenges. There's no doubt about that. But I think these are, as Brian said, reasons to be optimistic. So I'm really excited that we have a vaccine that is now deemed to be safe and effective in younger children, children 12 to 15 years of age. I expect, going forward in the coming months, we're going to see more data on both the safety and efficacy of these vaccines in even younger children. So there are roughly 17 million children in this age group, 12 to 15. So it's an important part of our population as a country to protect. We now have a new metric to follow, the proportion of individuals older than 12 years of age in the United States who've been fully vaccinated, and we stand at 42.5%. If you look at over 18 years, 45.6%. And what I think is truly remarkable, those older than 65 years of age, 71.8%. But as Brian pointed out, there are still a lot of people in the United States who are not yet vaccinated. So I think there are three reasons to have your child vaccinated against COVID-19. The first is obviously to protect your child from illness. Now, we know children are at lower risk than older adults, but millions, actually 1.5 million or more children have been infected. Here in the United States, about 13,000 hospitalized, several hundred have died. So children are certainly not exempt from getting severe COVID-19. We also know, as we've talked about before on these briefings, that some children, and even children who get very mild COVID-19, are at risk for this multi-system inflammatory syndrome that can affect the heart, the liver, the kidneys. So there are potential serious outcomes of infection with SARS coronavirus 2, even in children. The second is just to help your child return to normal life. I hope Brian's children can now go back to baseball, be on the baseball field this summer. But summer camp, school, this is how we're going to really get our children back to having their normal lives. And then lastly, The third reason is really to protect your family, friends, and community. Anyone who is susceptible to infection is really a potential transmitter. And it may be that, children may be at lower risk of transmitting, but they're still a potential transmitter of infection. So I think there are really three strong reasons why parents should have their children vaccinated. Now, we know, as you said, Lainie, there are parents who are reluctant to have their children vaccinated. There was a recent Kaiser Family Foundation survey suggesting maybe slightly less than 1/3 of all parents were ready to get their vaccinated as soon as possible, as Brian did with his children. But there's another quarter that really want to wait and see how this plays out. And then the remaining are really reluctant. They'll do so only if there's a school requirement, or not do it at all. So there's a lot of work to be done to addressing the concerns, helping to build trust, and also ways to really make it easier for children to be vaccinated. Recently, the CDC came out with guidelines that children can receive people can receive other vaccines along with the COVID-19 vaccine. We need to be able to get these vaccines not just to pediatrician's office and nurse practitioners, but to camps and parks and beaches, and really reach out to get children vaccinated. As we talked about, there are increasing efforts to really try to incentivize the vaccination, and I think the recent CDC guidelines on masking, where fully vaccinated individuals do not need to wear masks now, both indoors and outdoors. There's been some criticism of this, that maybe it came a little too fast. We can talk about that. But there are other interesting ways states are trying to incentivize vaccination, lotteries, and also using a certain vaccination threshold, such as 70% of the population, in order to lift the state mask mandates. But I think a lot of this also, for me, Lainie, raises a concern that Brian alluded to, the global vaccine inequities. And it must appear odd to folks in other countries that we in the United States have to do so much to try to convince some people in the population to get vaccinated. And also, as our colleague Jennifer Nuzzo has pointed out, there are potential, at least we need to have the ethical discussion about us vaccinating here in the United States younger and younger children, while there are many very high risk and vulnerable adults around the world who are still waiting to be vaccinated. So the United States really needs to step up, be a global leader in vaccinating the world. And there are a number of different mechanisms that the U.S. can do, and the Biden administration is taking some of these steps. But I think we're really at a critical juncture here, where the United States needs to play a leading role in in addressing the global vaccine inequities.
Thanks, Bill. So, not a surprise, we have a lot of questions coming in today related to the new CDC guidance about masking it. And so I'm going to do my best to combine them into one question that I'll give both of you a chance to respond. Bill, I think I'll start with you, given that you're trained as a pediatrician. So the theme here is, how should folks think about this new CDC guidance when they are fully vaccinated, but they live with folks, in many cases, young children, who are not vaccinated and probably won't be for quite some time? So what's your take first, Bill, and then Brian, to you?
Yeah. I mean, this is one of the challenges of the new CDC guidelines, I think. Obviously, we're in a position here in the pandemic where not everyone is eligible to be vaccinated, and certainly now, children younger than 12 years of age. So we have this kind of mixture of populations. We have fully vaccinated individuals or partially vaccinated individuals, people who have elected for various reasons not to be vaccinated or don't have access, and then a group of people who are just not yet eligible. And so, I think, as Brian said before, a lot of this around masking, I think, is going to come down to personal decisions around risks and benefits. I hope that many people will continue to wear masks in certain situations. even given the CDC guidelines. Those, and including those or family members where there are some who are either not eligible or have, for various reasons, chosen not to be eligible, or even there's a small population in the United States, as Brian knows well, that doesn't respond well to the vaccine because of immunosuppressive therapy. So we need to think about this very holistically. It's a complex issue. And I think people will continue to make personal choices, both for themselves and for their family members, and particularly for their children, about the need to wear masks to protect one another in certain circumstances.
Thanks, Bill. And Brian, would you give your perspective on this one as well, please?
Yeah, I think Bill, I agree with what Bill said about this, and in some level being a personal choice and understanding, there's so many different variables that we can put into play, and so many different scenarios we can, identify where it might be a good idea to continue wearing a mask even if you were vaccinated. I think we're still recommending wearing your masks on public transit and airplanes, because you're a close proximity to people for an extended period of time potentially, and so these vaccines are very, very effective, but we also need to remember that they're not 100% effective, right? So there still is a risk that someone could potentially have symptomatic disease or even asymptomatic disease and transmit it to somebody else. That risk is very, very low, and I think that's reflected in the new guidance. But masks, we know, are an effective way to prevent transmission and to keep people safe. And so I think, in my family, I'll give you an example from my family. We're still masking up. We're not planning on going to restaurants indoors until our kids are fully vaccinated. We've made it this far, and it's going to be another 5 weeks or so before they are, completed their 2-shot course and are 2 weeks out from that. And we haven't really addressed it yet as a family, what we're going to do when the kids reach that point, hopefully in the next 5 weeks where they are fully vaccinated. But I think that it's also kind of an awkward situation at times, right? Where if you're in a situation where you expect other people to not be wearing a mask and assume that they're vaccinated, that we know there are a lot of people who don't like to wear masks even before they were vaccinated. And so I think, I think you need to be mindful of your surroundings, your situation, your own personal context. And I think we also need to not accuse people of being overly cautious if they're wearing a mask. If I haven't had so much as a cold in the last 13 months, I've really enjoyed, not having those winter respiratory viruses. We haven't seen hardly any influenza cases in the state of Maryland. I haven't taken care of a single flu patient this entire year, where normally I have many people in the ICU with influenza, some people who die from it. We're not seeing other respiratory viruses. So there are reasons to think that masking at certain times are going to be appropriate. And a discussion I think we need to have moving forward is, may there be times in the future, even aside from coronavirus, where it would be advisable to consider wearing masks to try to prevent community spread of respiratory viruses that we know can harm people and kill others. So I think this is just sort of the first starting point of this discussion that we need to have. And I think we need more time to see how this plays out.
Thanks, Brian. I think you're right. For sure, we'll be revisiting this one during future versions of this briefing. And Brian, I'm going to stick with you for a minute because we're getting several clinically oriented questions today. One concerns where we are in terms of treatment for so-called long COVID, and in both treatment and is it true that there may be some federal guidelines coming out soon about it?
Yeah, so we're still learning every day something new about long COVID, and there's different definitions that are out there, but in general, these are people who 2 or 3 months out from their COVID infection have not really returned to their baseline health status before they got sick with COVID. And we're still learning, what are the risk factors for developing this. It certainly seems true that people who were sicker with COVID are more likely to have severe symptoms longer term after COVID, but we know there are many people who were never hospitalized, who maybe even had just mild symptoms, who still 3-4 months out have lingering symptoms that appeared after their initial COVID infection. So right now we don't have a clear way to treat those symptoms. There's been anecdotal reports about people who have gotten the vaccine whose symptoms have gotten better, but that we haven't seen any widespread data on that to know if that's actually a true phenomenon. Independent of that, everyone should be getting vaccinated, because at this point, even if you've had COVID many months ago, we don't know how long natural immunity wanes. And with variants that are circulating. We know the vaccines protect you against those variants, so you should still get vaccinated even if you've had COVID. The NIH has a large research plan that hopefully will be announced soon, where they're going to have over $1 billion in research being put towards understanding long COVID. And there's talk that there will be guidance coming out from the CDC and perhaps even the NIH about how to think about long COVID, how to coordinate care for those people, because many health systems across the country have really put together their own systems and plans to try to deal with the hundreds, if not thousands, of people that they're seeing who have these lingering symptoms. So I think there's going to be a large coordinated effort, and this is going to be something we're going to be working on for years to come, because there are millions of people who are at risk for developing these long-term symptoms, and we're not quite yet sure the extent of what might be happening after people get COVID.
Thanks so much, Brian. Bill, I'm going to turn back to you now. No surprise, lots of questions about vaccines today. Several coming in about the situation in India and what we're hearing about the variant that's been identified there. So how should we think about that in terms of the COVID vaccines?
Yeah, so this is a very important issue, Lainie, and obviously not a new one. We've been discussing these various variants of concern and how they may affect transmissibility, how they may affect disease severity, and very importantly, whether or not they're escaping the immunity. And the evidence thus far, it's complex, but the bottom line, as I understand it, is that our current vaccines remain highly protective, particularly against severe disease, against these variants of concerns. There are some differences, some pairings that aren't so highly effective. So, for example, the AstraZeneca vaccine and the variant first identified in South Africa, the B1351 variant. But obviously, anytime there's a tremendous virus transmission, as there has been in India, it just provides an opportunity for viral mutations and advantageous mutations to emerge, and that may be what we're seeing now. We don't have a full understanding, certainly by far, of what's happening in India, but this variant B1617 is of concern. It's been observed in the United Kingdom as well, and they're beginning to take some steps to mitigate its transmission there. So I think we need to learn more about whether this is really different, I'll say, than the prior variants of concern in its ability to escape vaccine-induced immunity. And if there is evidence, and I often say I think the red flag is if we really start seeing hospitalizations and deaths in people who are fully immunized, that's a red flag. And we do know, and we've talked about this before, one of the advantages of these what I call genetic recipe vaccines, the mRNA or adenovirus vector vaccines, is they can be, it's relatively straightforward to adapt them to new variants, but still a lot more to learn about that, but it is of some concern, certainly.
Thanks, Bill. Another question for you, and this one really concerns durability of the COVID vaccines, but especially with an eye towards the new CDC guidelines with masking, or not masking. What do we know about how long immunity is likely to last once you're vaccinated, and then how do we think about that with wearing a mask?
Yeah, I wish I knew the answer to that question, but I think again we're still learning. We're still relatively new into this process, so we don't yet know, how long the duration of immunity lasts. And again, another sign of failure, vaccine failure, is going to be hospitalizations and deaths. That's going to be the really critical sign in people who are fully immunized, whether it's with a new variant or whether it's a consequence of waning immunity. In terms of the evidence base, we have the 6-month data from the Pfizer and Moderna trials that looks really good, but it's just very hard to predict. when we will begin to see more and more breakthrough infections as a consequence of waning immunity. Now, this does have implications for this new CDC vaccination guideline, or I'm sorry, masking guidelines, and this is why I think some people are very cautious about this, and I think we're going to need to obviously very carefully monitor case counts, and I think perhaps be prepared. Should we see another surge in cases, we may have to take a step back.
Thanks, Bill. Brian, question for you. Given the announcement from CDC this week, what's your best advice as a clinician for those who are fully vaccinated but are also immunocompromised when it comes to mask wearing now?
So, there's many different conditions that lead to an compromised immune system. So I think this is definitely an issue where people need to talk to their doctor, particularly the doctors who are treating them for their conditions or prescribing medications that might impact their immune system. We know, for example, that people who have had solid organ transplants, up to half of them do not mount an antibody response to the vaccines. That doesn't mean they don't have some immunity to the vaccine, because the immune response to the SARS-CoV-2 is more complex than just measuring antibodies in the bloodstream. But I think we don't know yet what the true level of protection is for those people. So I think people who have underlying immunocompromised conditions need to talk to their physicians, and I think they need to be extra careful. And I would be very reluctant to just take off a mask right now unless you have that conversation, you understand what your particular immune system problem is, what vaccine you got, when you got it, and what the current data is in relationship to your particular condition. But I would urge caution at this point in someone who has an underlying immunocompromised state where we're not sure what their true level of protection is going to be. And I did want to say, in agreement with what Bill was talking about, I think that the whole mask situation is very fluid, right? These decisions or recommendations are made based on the data as we have them now, and that data can change. And if you're in a group that feels like you're ready to take off your mask indoors, that may be true today. But as we learn more and as things change, both in the US but across the world, I think we need to be flexible in recognizing that there may come a time again where we say more strongly, you need to be wearing a mask in certain situations. So this is not the end of mask wearing, but I do think it reflects how effective the vaccines are that we're in a position to even have this discussion. Can I take off my mask indoors right now around other people if I've been vaccinated?
Thanks, Brian. And we're coming up on 12:30, so that'll be the last word for this briefing. I'd like to thank Brian Garibaldi and Bill Moss for joining me today, and give a big thank you to everyone who joined us, and especially to those who submitted questions for our experts to answer. This briefing will be archived and available on coronavirus.jhu.edu. As a reminder, we'll continue to offer these regular 30-minute briefings on Fridays at 12 p.m. And in each briefing, we'll focus on what you need to know right now about the COVID-19 pandemic, and we'll have live Q&A with our experts. I'll look forward to seeing you at our next 30-minute briefing. Until then, thanks and stay safe.